welcome to another episode of Why I Didn't, the mostly useless series where I tell you why I did not pursue a particular specialty in medicine. In this episode, we're covering ENT, aka Otorhinolaryngology. What's up, guys? For those of you who are new here, my name is Kevin Jabal, physician entrepreneur based in Las Vegas, formerly in plastic surgery. Now, if you do want a more useful and much more objective overview of ENT from the actual perspective of ENT doctors, the experts of the field, then check out So You Want to Be an ENT over on the Med School Insiders channel, link in the description. And if you're a pre-med trying to get into medical school, then check out the Med School Insiders Pre-Med Roadmap to Medical School Acceptance course, which is now 40% off for a limited time. Coupon and link down in the description, and if you're a channel member, you'll get an even bigger discount.
Yeah, boy.
Now with that out of the way, let's dive into ENT. So first, what I liked about ENT. It's gonna be no surprise because ENT and plastic surgery do have some overlap, that one of the things I really liked about ENT was the procedure type. And especially in the last 10 or so years, a lot of ENTs started moving more in the direction of doing their own microsurgery. Before that, a lot of plastic surgeons would be called in to harvest free flaps and things like that, but in the last 10 years or so, a lot of ENT departments have been taking that responsibility on themselves. Microsurgery and these free flaps were always the most exciting science fiction part of plastic surgery in my mind. And ENTs do some of that too. So as an example, they can go to the radial forearm and take some soft tissue, take some bone, and then move it up to the jaw if they're trying to reconstruct after a cancer resection, as an example. But obviously that's just one very niche type of procedure, and there's a lot more to ENT. And they do have a good variety of procedures to keep things interesting. You have a lot of facial trauma, which you're normally sharing with plastics and OMFS. Those three services are usually covering face call. You're giving patients new hearing, new voices, new airways. You're doing endoscopic sinus surgery. You'll even do skull-based approaches to help neurosurgeons with their brain cancer resections. And then of course, as we were mentioning with microsurgery, a lot of the really complex head and neck reconstructions. And similar to a couple other surgical subspecialties, it's really cool that you can do open, endoscopic, and micro all within the umbrella of one specialty. Reason number two, which is similar to reason number one, is the overlap with plastic surgery. But it's beyond just the complex reconstructions with free flaps, but even things like doing a facial plastics fellowship after your ENT residency and then focusing on facial aesthetics. There are many differences between ENT and plastics, but there is a good amount of overlap as well. So if you wanna see why I love plastic surgery so much, then check out this video, also linked below. Reason number three would be the personalities. ENTs are almost universally known as the normal and nice surgeons. They're a little bit more laid back, they're a little bit nerdier than the average plastics, neuro, ortho bro. There were a couple times where I remember working with an ENT resident. I was out on a away rotation, and one guy was rotating on the plastic service and he was an ENT intern, and just such a chill, laid back, normal, likable guy that was genuinely kind, wanted to help me out, and just a solid dude. And I have similar experiences with other ENTs at other programs, both as a med student and even as a resident. I feel like there's some truth to medical stereotypes, and ENTs being more likable, normal, and chill seems to be pretty consistent. Reason number four is the compensation, which is on the higher end, usually in the top 5 of all specialties. The current average for ENTs is $469,000. Nice.
Very nice.
Which places it just after plastics, ortho, cards, and neurosurgery, which are in the high 400s to 500s. Reason number 5 is that it's a fairly small specialty. In terms of residency positions each year, it's roughly 350. And to give you some context, ortho every year has 900 spots, neurosurgery is 240, plastics is 190, vascular surgery for the categorical, not the general surgery fellowship, is 80, and thoracic surgery, again categorical, is 50. And if these numbers sound low, it's because they are. When you're looking at non-surgical specialties, there are thousands and thousands of seats every year. When it comes to surgical subspecialties, they're way smaller. And with that lower number of residency seats, that also means a lower number of total attendings practicing in the US in that specialty. And I personally enjoy that smaller community aspect where you go to conferences and you just generally know most of the people in your field versus EM or IM, and there's thousands and thousands of attendings and you just get lost in the sea. Overall, not a really strong preference, not a deal breaker by any means, but a slight preference. Number 6 is the lifestyle, and ENT offers a lot of flexibility here. You can be doing the crazy complex, sexy microsurgical cases, or you can be doing the really quick outpatient office procedures. When you're doing smaller outpatient procedures, it tends to give you more flexibility and a better lifestyle where you're not working crazy insane hours. You can stick to something that's more normal and still make a good living. There's also a blend of surgical and medical options within ENT, so you can tailor your practice to what you're optimizing for over your career. What I mean by that is when you're younger, you have more energy, a little bit more ambitious, maybe you want to handle more complex surgeries. But as you get older, maybe you want more straightforward cases, a little bit simpler, or even you want to transition more to clinic and medical management instead. Next up is immunity from mid-level creep, a really, really important point, and essentially all surgical subspecialties are immune from this or much more resistant than non-surgical medical specialties, but still a massively important point that bears mentioning. And lastly, the anatomy, which I'm actually kind of torn about, to be honest. So on one hand, it's super complex, super intricate, and there's so much going on in such a small amount of space, and there's some beauty in that complexity. I can actually remember back to anatomy lab as a first-year medical student, and working in the head and neck region was one of my favorites because there was just so much going on. It was a more exciting part than the gut, as an example. I mean, even with the external carotid artery, just knowing the branches of that, you need a mnemonic of some anatomists love fucking, others prefer S&M, just because there's so much to it. But I will admit that a large part of my fascination with the area was probably more tied to neurology and neurosurgery, and just figuring out, the contralateral, ipsilateral, the deficits, what's gonna happen if you have a lesion here versus there. I found that to be pretty fun too. And that brings me to what I didn't like about ENT. And first off, anatomy. So again, there's some things I like about anatomy, but some things I did not. And while I appreciate how nuanced and complex the anatomy is, it's ultimately just very limiting. You're in one small region of the human body and you don't really explore beyond that. It can also be kind of nasty given the glands and fluids in the head and neck region. When you're looking at anatomic regions in surgery, you have to consider two things. So number one, what do you think of that region when everything is clean at baseline? And then number two, what do you think of that region when you have body fluids and other secretions? So for me, blood was never a problem. Respiratory secretions, mucus, pretty nasty, and then pus, stool, GI stuff somewhere in the middle. And actually, now that I think about it, of all the areas of specialization within plastic surgery, craniofacial was usually my least favorite. Not that I didn't like it, but I would just rather be doing hand or micro or something else, in large part because of the various secretions and whatnot. Second is the bread and butter. Now, when you look at a specialty, you can't get too enamored by the sexy zebras, the cool rare things, the microsurgery, whatever, unless you really specialize in just microsurgery. You have to consider the bread and butter. What are you normally going to be seeing day in and day out in that specialty? For ENT, that's things like tonsillectomies, tube placements, sleep apnea, dizziness workups, chronic sinusitis, allergic rhinitis, things like that. And that bread and butter wasn't the most exciting and captivating to me personally. And usually bread and butter isn't going to be the most exciting thing. It's the most normal thing, the most routine thing that you're gonna see, but you need to find a bread and butter that you don't mind. Next up is the variety. And while ENT does have some variety to the specialty, it's nowhere close to something like plastic surgery, which is head to toe, soft and bony structures. And while ENT does have a lot of different procedure types, apart from occasionally harvesting flaps from below the neck, you're generally not working below the neck. I like variety, and despite what my mom says, there's no shame in that. And lastly, you're gonna see a theme here with other Why I Didn't episodes. It's the clinic. There's lots of clinic in ENT, more so than most other surgical subspecialties. On the spectrum of OR versus clinic, think of it as closer to optho and urology rather than something like trauma surgery. And that's why I did not pursue ENT. Remember, Pre-Med Roadmap course is 40% off for a limited time. If you want to learn more about ENT from a more objective perspective, then check out So You Want to Be an ENT here on the Med School Insiders channel, or another episode from Why I Didn't. Much love, and I'll see you guys there.
Skate, skate! Very nice.